Hello everyone, and welcome back to Dr. Phuong Official. I'm Dr. Phuong, and I'm so glad you're here. Today, we're going to tackle a really important and often sensitive topic, understanding what happens after a severe stroke, particularly when it comes to the signs that a person might be nearing the end of their life. This is a difficult subject to talk about, but it's crucial for both patients and their loved ones to have clear, compassionate information. Stroke, as you might know, is actually the 5th leading cause of death in the United States, so it affects many families. My goal today is to help you understand the journey after a severe stroke, including the role of different types of care and, importantly, how to recognize signs of decline, so you can be as prepared and informed as possible. Let's get started. First, let's quickly recap what a stroke is. A stroke, also known as a cerebral vascular accident or CVA, is basically an abrupt interruption of blood supply to the brain. This can happen in one of two ways. Either an artery supplying blood to the brain gets blocked, which we call an ischemic stroke, or there's bleeding within the brain itself, known as a hemorrhagic stroke. The impact of a stroke and how well someone recovers can vary hugely. It depends on several factors: the person's age, where in the brain the stroke occurred, how severe the damage to the brain tissue is, and if they have other existing health conditions. In the acute phase, right after a stroke, it can take some time to see the full effects. The American Heart Association tells us that most progress in recovery happens within the first 3 to 4 months, though full recovery can take up to 2 years. During this time, doctors will give the patient time to begin recovering before making a long-term prognosis. Now, if a stroke leaves significant neurological deficits, meaning lasting effects, it's sometimes called a chronic stroke or chronic cerebrovascular disease. With good medical care and rehabilitation, some people might regain some lost function. However, sadly, others may not respond as well to treatment and might continue to decline in health, even with intensive care. This brings us to a very important aspect of care: palliative care and hospice care. You might have heard these terms, but let's clarify them. Palliative care is all about providing symptom relief for patients dealing with a serious illness that significantly impacts their quality of life. It's focused on comfort and support, not just on curing the disease. Palliative care can be temporary or long-term, while a patient is still receiving treatment. It's really appropriate when a severe stroke patient is still being assessed for their prognosis. It ensures that comfort and quality of life are priorities from the start. Now, hospice care is a specific type of end-of-life care. A patient might transition into hospice care if their prognosis becomes terminal, meaning their illness is no longer curable and they are expected to live for a limited time. For stroke patients, hospice is considered when there's a poor prognosis. For example, if there's no improvement in neurological functioning after the first 3 days following a severe stroke, that can be a sign that hospice care might be appropriate to consider. Death can occur immediately after a stroke, or it could happen weeks or months later. Early hospice care, when appropriate, is crucial for managing symptoms effectively and preparing everyone involved for what lies ahead. When someone has had a severe stroke, especially one that impacts many body systems, managing symptoms becomes a primary focus of palliative care. Because the neurological system is involved in almost every other body function, the distressing symptoms can be quite diverse. Here are some you might encounter. Pain. This can be due to immobility or involuntary muscle contractions and spasms caused by neurological damage. Shortness of breath or dyspnea. This is common, sometimes caused by aspiration pneumonia, which happens when food or liquid accidentally goes into the lungs. Gastrointestinal issues. Nausea, vomiting, and constipation are common, often caused by medications or challenges with eating. Skin sores. Immobility can lead to bed sores, which can be very uncomfortable or painful. Emotional distress. Damage to parts of the brain, or simply the emotional toll of the dying process, can lead to anxiety, restlessness, and depression. Proper symptom management is key to ensuring comfort and dignity. This is the most sensitive part of our discussion. It's important to understand that it's not always possible to predict if someone who has had a severe stroke will die. Getting medical help as quickly as possible is vital and can significantly improve a person's chance of survival. However, certain types of strokes are more likely to be fatal, especially those that affect the part of the brain responsible for automatic functions like breathing and circulation. In the most severe cases, a patient might be in a coma and show no response to painful stimulation, no verbal response, and no brainstem activity. These are very serious signs. Specific signs of impending death after a stroke may include shortness of breath. As we discussed, this can be very distressing. Pain. Despite efforts to manage it, pain can be a persistent issue. Dry mouth. This is a common symptom in end-of-life care. Anxiety, agitation, or psychological distress. These emotional and mental signs are also important to recognize and address. And finally, a characteristic rattling sound in the lungs, sometimes called a death rattle, can occur. Regarding lifespan after a stroke, it really varies significantly. It depends on the person's overall health, the type of stroke they had, how quickly they received medical care, and whether they became disabled. For example, an 80-year-old male with no significant disabilities after a stroke might have an average life expectancy of around 9 more years, but if that same person has a severe disability, their life expectancy could be only a few years. Beyond the immediate signs, there are specific factors associated with an increased risk of death, especially from a chronic stroke. These include dysphagia. This is trouble swallowing, which can lead to malnutrition or aspiration pneumonia, where food or liquid is inhaled into the lungs. Malnutrition. Even if a patient is receiving artificial nutrition through a feeding tube, they might still show signs of malnutrition, such as significant weight loss. Recurrent infections. Repeated infections, like urinary tract infections without a clear cause, can be a major concern. Being bedbound. This significantly increases risks for various complications. Needing maximal assistance for self-care, if a person can't perform basic daily activities on their own. Inability to maintain hydration or caloric intake, if they can't get enough fluids or calories to sustain themselves. Healthcare providers also use tools to evaluate consciousness after a stroke, particularly if someone is in a coma. One common tool is the Glasgow Coma Scale, or GCS. This scale helps doctors monitor whether a patient is improving or worsening. A score between 3 and 15 is given based on how the person responds to painful stimuli, if they respond verbally, if they move on command, and if they open their eyes spontaneously. A score of 8 or less suggests a severe brain injury, 9 to 12 suggests a moderate injury, and 13 or higher indicates a mild brain injury. Finally, I want to briefly mention locked-in syndrome. This is a very rare condition that can occur after a stroke in the brainstem. In this syndrome, a person is fully conscious and aware, but they are completely unable to move or speak. It's a challenging condition, and again, highlights the diverse and severe impacts a stroke can have. So, to summarize, the journey after a stroke can range from a complete recovery to permanent disability, or sadly, it can lead to death in the weeks or months following the event. While it's not always possible to predict the outcome, if a patient shows little signs of recovery after the first few days, especially if no neurological improvement is seen after 3 days, it can be a sign that hospice care should be considered. Key signs that someone who has had a stroke is nearing death often include difficulty breathing, significant pain, and that characteristic rattling sound in the lungs. The most important takeaway is that timely medical help and appropriate care, whether it's palliative care for symptom management or hospice care for end-of-life comfort, are vital for ensuring the best possible quality of life for stroke patients and their families. Remember, the information I've shared today is for informational and educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always consult with your healthcare provider for any specific medical concerns. Thank you so much for joining me today on Dr. Phuong Official. I hope this video has provided you with valuable insights and support. If you found this information helpful, please give this video a thumbs up, share it with someone who might benefit, and don't forget to subscribe to Dr. Phuong Official for more health discussions. Take care of yourselves and each other.